with something that kind of irks me. You know, we all gossip about it. Did she or didn't she? Did he or didn't he? When it comes to whether or not celebrities have had plastic surgery. You know, famous faces suddenly look so refreshed and wrinkle-free. Well, this one kind of ticks me off because it's one of the many things they've lied about me about. You know, when I read about myself in tabloids or other people, I should say, talk to me about me or what they've read. You know, they've said that I had brow lifts and this pulled and that tucked. And I'm like, if I had a weekend off, do you really think I would lift this? I would do something about this before I do something. You know, I don't know that I'd ever be vain enough to cut myself for this, but I don't know. It's a game we all play, so here to suss out did they or didn't they in general is our good buddy, Dr. Anthony Youn. He's back. He's going to give us a plastic surgery dish on some stars and some people in the headlines. He's going to give his opinion about what they did or didn't do. Yeah?
Yes, I will. So thanks for having me on.
Well, you know, this is a subject it's kind of touchy to me because I haven't had bupkis, nothing. So, you know.
I don't see any signs of plastic surgery from here.
Yeah, that's because he's on our show. But thank you, Doctor. You're sweet. Thank you. So, can you spot, as a professional, do you feel that when you're thumbing through the magazines or just watching the evening news, can you spot work when it's been done?
I usually can, and I actually tell my patients, Rachel, that good plastic surgery is work that most people can't spot except for an experienced plastic surgeon like myself.
All right, so, you know, of course, the person that everyone is talking about in the news is the mother of 14, Nadia Solman. Everybody's talking about whether or not she had her face surgically altered to look more like the very beautiful Angelina Jolie.
Yep.
So Lara Spencer, our friend over at The Insider, recently sat down with her. Let's take a look at a few minutes from that.
Regardless of what I was saying, regardless of who I am, people are already going to have judged me before they saw me, before they heard me.
We went from the sort of Octomom judgments all right into the Angelina allegedly being creeped out by you.
You know what? I don't know any celebrity. I don't want to know any celebrity. I don't follow their lives. I don't want to be a celebrity.
Do you see any resemblance, Angela?
I don't. I see nothing. I have no clue who she was 3 years ago. I went out with my friend, I remember, and some guys came up to us and mentioned that. I'm like, who's that? Who's that?
So the rumors of you having plastic surgery to look like Angelina.
Never. God, no. I'm sorry, I shouldn't have said that, but rumors, total erroneous jokes.
Okay, so let's say, you know, obviously you have not treated her directly.
No.
And, you know, whether she has or she hasn't, let me just say, I would find it impossible to believe that anyone living on the planet Earth was unaware of who Angelina Jolie is.
Exactly.
I mean, I find that part of that argument a little ridiculous. And again, it's her private business, whoever she wants to look like or not look like, but saying as part of the reasoning that she had no idea who Angelina Jolie was sounds silly.
And as you can see, she denies having plastic surgery, and she has actually stated also that the changes that we see in her face are probably just due to her pregnancy. Well, let's take a look at some pictures of her. Now, we do have a photo of her before anybody knew her as the Octomom. And when we compare this picture to a photo much more recently, the Octomom that we know...
I'm sorry, that just, to me, that does not look like the same human being.
So it does look, when we take a look at the picture, you can see her nose is obviously looks thinner afterwards.
The bridge of her nose is different, yeah.
Yep, and her lips, you take a peek at her lips before and after, they look quite a bit larger. Now, I've never treated her, I've never met her, but looking at the pictures, I believe she may have had plastic surgery done. You know, that's my opinion. A nose job and maybe a lip augmentation. I've got actually something here that I think is pretty interesting, and I wanted to show it to you. Now, this is an actual lip implant, and this is something that she may or may not have had put into her lips. And this is a very standard type of lip implant that we use, and I'll show it to you right here. And what we do is I can take this implant, and I actually roll it up into the shape of a Tootsie Roll. And using a surgical instrument, I can put this into the lips and make the lips larger.
Really?
Do you want to touch it?
Doesn't it feel like you have rolled up toilet paper in your lips?
It kind of feels a little strange. Now, can you guess what this might be?
Oh, God, I just touched it. Oh, I don't know. Do I want to know?
This is actually cadaver skin.
Don't do that to me!
Now, don't worry, though. There's no cells in it. It's been chemically treated, so there's no actual cells in it. So
it's a dead something!
It's fine. But this is actually something that people have put into their lips to enlarge them. And
I used to really like you,
clean.
man.
It's completely clean. Don't worry about it.
Oh, It's a dead person?
Kind of crazy stuff.
Kind of creepy.
Yeah, kind of crazy stuff.
That is creepy. Wow. So what's next, Dr. Youn?
Well, his reps have denied it, but there have been some reports in the media that Michael Jackson may be suffering from a staph infection of his face. Now, there's actually one outlet that has claimed, and we don't know for sure, but they have claimed that it may even be a Mrsa type infection, and it can possibly be related to plastic surgery. Now, what Mrsa is it is a type of bacteria that can cause severe infections that are actually resistant to typical antibiotics, and that's why we call it a superbug. In rare cases, Mrsa can cause infections that are so severe it can actually destroy tissue and can even result in death. But it is not, however, flesh-eating bacteria. Now, we actually have some pictures. They're pretty graphic, so I'll warn you right now.
I'm so not having fun.
There's some pictures. Now, this is somebody who's had a Mrsa infection of their face.
I could just look at the reaction in their faces and get
another one here. And like I said, it can be a very serious infection. Now, in the hospital, when we treat these patients, we are required to wear protective garments. Mask, gloves, even a hat, and we're required to wear a big gown like this to protect ourselves.
Right.
Now, while Mrsa is all over the news and people are talking about it, being dangerous, the important thing to realize, and for the viewers to realize, is that it is a very rare type of infection. This is not flesh-eating bacteria. This is not something you need to worry about every day. But the things people need to do is to make sure they don't share towels, don't share personal items like razors, and cover up any wounds. Don't touch anybody else's wounds. You do that, and the chances of this being a problem is extremely, extremely small.
Wow. Again, wow. Don't even know where to go with that, so we're going to move along. So Usher's wife, Tamika, this is another thing that's been in the news a lot of gossip about this, whether or not she had work done at all, and the fact that she had it, reportedly done out of the country. Now, why would somebody, other than the obvious, I guess, not wanting anybody to know, why would you get plastic surgery done out of the country?
Well, there are two main reasons, and usually it's either to save money or for better anonymity. Now, last year, there were actually 1.5 million Americans were estimated to have traveled overseas or to a different country for some type of health care. Wow. And what we're finding is that we're seeing increased numbers of people having botched plastic surgery or complications from that who've come back, to get treatment here in the United States. And we actually do have somebody here. Her name is Stacy, and she has a story that she'd like to tell us.
Hi, Stacy.
Hi.
How are you?
Okay.
So, Stacy, when you thought about having a procedure done outside of the country, was it for either of those reasons? Either it was privacy factor or the monetary value?
The money issue, yeah. Plastic surgery in the United States is way more than outside of the country.
So what happened?
Well, I had lost a lot of weight. I was very heavy my whole life, and I lost a lot of weight. And when you lose like an enormous amount of weight, you have a lot of excess skin, a lot of, hanging skin everywhere. So it was kind of like I needed plastic surgery everywhere, and it was a lot, and it was too much. I couldn't afford to do it here. So I had heard about going out of the country, and I ended up going down to Costa Rica, and I did as much investigating as you can do, like online, and I thought I knew what I needed to know, and I went down there, and I had the surgery, and, I went down, I went to a regular hospital. It wasn't like I was in a hut in the middle of the woods or anything. It was a nice hospital. Everything looked fine.
It didn't look like a horror movie outtake or something.
Right, a lot of people are like, I can't believe you did that. Right, but everything seemed okay. And then from the minute I woke up from the surgery, I just had complication after complication. And then I ended up coming home about a week later.
My gosh.
And it just kept getting worse and worse and worse. And I ended up going into the emergency room here, and they had to remove a large portion of my stomach and my abdomen, and I've had like 5 or 6 reconstructions to just fix my stomach, not to mention the rest of my body. But
are you okay now? Are you better now?
Yeah, I'm good.
I mean, so this is an extreme case, but this is an example of what can happen.
Yeah, so it's definitely important for people to realize, number one, if you're going to have plastic surgery in another country, make sure that you find somebody that you trust, okay? Now, some people can go to, and one thing I recommend, is there are international members of the American Society of Plastic Surgeons, and they have been pre-screened for their experience and for their training. But one thing also to remember is that your health insurance here in the United States may not cover any complications or medical care that you need in another country. Plastic surgery is a very serious thing. I mean, you can see these pictures. I mean, this is not something you take lightly. It's not as easy as getting your hair done.
It's surgery.
Exactly. And I tell my patients, they come to see me and they'll say, Rachel, Dr. Youn, what's the absolute worst thing that can happen if I have plastic surgery? And I start with, you can die, and we go from there.
Yeah, so work backwards from death.
Exactly. Yeah. So it's very important people realize, just take it seriously. Do your research your surgeon, research where you have it done at, and research the procedure itself. You do that, and the chances are you're going to be real happy and will do just fine. Now, I actually had a patient who came to see me in the emergency room, and this is kind of a strange story, but they called me in, they said, Dr. Youn, we have somebody here who had a tummy tuck done in Mexico, and she had it done 2 weeks ago. She just flew back, and she's got these huge tubes sticking out of her tummy. So I came to the emergency room and literally saw 2 of these things. Now, these weren't her actual tubes, so don't worry, I wouldn't do that to you. But she had 2 of these things literally sticking out of her. Now, you can contrast that with the type of tube that I use to drain out fluid in my surgery. I leave this in for maybe 3 to 7 days. They left this in for at least 2 weeks. I mean, plastic surgery in other countries can be different than what you see here in the United States.
Now that really is like right out of a horror movie. Certainly, I wouldn't want that dangling out of me for 2 weeks.
If I use that in my patients, my practice would be over probably within a week. So,
well, no. I should hope so.
Yeah.
I mean, no offense, but so when you have plastic surgery within this country, there's many more guidelines. It's easier to research them. Outside of the country, you would suggest looking for members of the international...
Yeah, international members of the American Society of Plastic Surgeons. And at least,
they're held to the same criteria and standards.
Yeah, at least somebody has done some homework for you.
All right, so now we're going to talk about another woman who was really open. I really loved this about Tara Reid. Tara Reid went through a terrible, painful process. She went to go get liposuction, correct?
Exactly.
And she talked about what went wrong and was very open about it. And I commend her for doing that.
So Tara Reid did admit to undergoing botched liposuction and breast surgery, and unfortunately left her with some pretty unsightly scars and big dents in her abdomen. And unfortunately, what we find is that plastic surgery now is not just for people who are getting older or trying not to look like they're getting older. Young Hollywood is feeling the pressure to be perfect, and they're having these plastic surgeries with sometimes disastrous results. And many of these women, like Tara Reid, really should never have had anything done in the first place. So now, Rachel, I actually have pictures of a patient of mine who had some botched liposuction surgery back in my state of Michigan. And she had actually went to a different surgeon, and that surgeon did liposuction on her tummy and told her erroneously that her skin would tighten up. And as you can see, it's quite loose and hanging. So what I did was I performed a tummy tuck on her. And this really was a surgery she should have had from the beginning. And as you can see in the after picture, she looks a lot better. Wow. All that skin is removed. Now, I have a couple of things I brought in here. This is actually a liposuction cannula. Don't worry, it's clean. It doesn't have any germs on it.
I am still a little freaked out from the cadaver lips. Sorry.
And this is one actually that other surgeons sometimes will use. And it's a bit obviously large, but you can see if you use something like this on a tiny person, you can get some major problems.
This would be very invasive on a woman that's literally 0 or 2.
Exactly.
Yeah.
And a big thing to realize, liposuction is not meant for skinny people. I get a lot of people that come to see me, and I look at them and I say, you're 5'6", you weigh 105 pounds, and you're here for liposuction? No,
they literally just want an imperfection removed, and that's not what that was designed for.
Exactly, and they're better off actually seeing a therapist than they are seeing me.
And overall, I think that's a lot of what we're talking about here and why we all gossip about it so much, because it does seem to be, in many cases, in all of the extremes at least, more of a mental issue than a physical issue for a lot of people.
Exactly, and studies have shown that the vast majority of people that have plastic surgery really benefit from it. I mean, you can get a great improvement in your life, but I tell you, there's one quote from, we're talking about celebrities today, that I need to say, and Kenny Rogers, he's an icon, music icon, but he has admitted to having botched plastic surgery.
Yes. Yeah.
And I do tell my patients, it's important to know when to nip them, know when to tuck it, know when to walk away, and know when to run from the plastic surgeon's knife.
Perfect. Enough said. I didn't think I'd make it through that segment, but thank you, Dr. Youn.
Thank you, Rachel.
Thank you. You made me comfortable talking about something that makes me very uncomfortable.
Thank you.
Whew. All right, grab a snack. We'll be right back. Go nipper tucking.